When the first COVID vaccines became available to the general public, the rush for appointments was overwhelming. There were different, complex online registration and booking procedures for every county and health district. Securing a vaccine required access to a computer and the time to devote to search for available appointments. That system of distribution was not accessible to thousands of our neighbors, including those without Wi-Fi or home computers, those who are visually impaired, the elderly, or anyone without skills to navigate the sign-up process effectively. In response, a group of individuals began to help others navigate the system and successfully secure appointments. These vaccine angels worked for hours every day to ensure that people in need had access to vaccines, even providing transportation for those who couldn't drive to their appointments. These grassroots teams were on the front lines of the battle for health equity and securing vaccine access for thousands of our neighbors across the community.
Hi, everybody. I'm Dr. Lewis Appel, Chief Medical Officer for People's Community Clinic. It's so inspiring what you all did, and speaking from the perspective of folks who were, trying to get our own patients immunized and access. It was so clear from the beginning that there was such a disconnect between the technology that people were being forced to use and what people had access to. That what was needed was a human connection, and that's what you all provided, was that piece of humanity. And I think it's that relational piece, that actual person-to-person connection that really makes a difference. And it's what made a difference in this. It's what makes a difference in healthcare, and it's really what health is about. And I'm just so inspired by what you all have done and what you're continuing to do. With that, I'd like to just say that all of you who came to be known as vaccine angels dedicated countless hours to help others get vaccinated. Your efforts saved lives by helping to prevent the spread of COVID-19. On behalf of People's Community Clinic, I'd like to present to you the Vaccine Angels of Austin, the W. Neal Kocurek Award for Healthcare Advocacy. Thank you for your remarkable service to our community.
I think for many of us, this became a bit of an addiction. And it's kind of like, okay, we've helped, all the elderly people we can find. Let's find people who, English is not their first language. Let's find people who are working all day with children or working all day in retail. Who else can we find? It was kind of like unearthing people, because a lot of folks felt they didn't deserve our help after, and there was a period where there was more vaccine available and there was people who weren't getting vaccinated because they didn't have time or didn't want to deal with it. And we almost had to tell people, it's okay. We are happy to help you. Please fill out our form. So it was fun.
Something I found very moving when I was volunteering to find people vaccine appointments was how surprised most people were that it worked out. I would text or call somebody with an appointment and they would say, no way, are you kidding me? Is this a joke? I filled out that form, or my granddaughter told me to fill out that form, but I never thought anything would come of it. And it really meant a lot to people that there was somebody out there, a stranger out there, who actually cared that they were safe and that they were healthy and that they were protected in the pandemic. And I feel a little bit of that now that y'all recognize our efforts. And seeing all these faces and knowing that there are lots of people out there who care that we are safe and healthy and getting through this together.
That, I think, was one of the most beautiful things that all of us witnessed, the community coming together to get the seniors vaccinated. Those were very scary times earlier this year. And I think that made us, we didn't mind staying up all night long to get them appointments. It made it magical.
Yes, and thank you for this award, because it does provide another moment for us to come together and just appreciate. I think we've all been through a lot, even since maybe we were in it, and some of us are still in it, but seeing each other and it's kind of gets, what can we do next? There's going to be a lot of challenges, and it's great to see there's people out there that want to help and are willing to just do what needs to be done.